Let's listen to an expert, Dr. Mohit Gupta, DM Cardiology, GB Pant Hospital, New Delhi, for hypertension in young population along with coronary artery disease and higher heart rate can be sure of happy heart.
Hello, I'm Dr. Mohit Gupta. I'm professor of cardiology in GB Pant Hospital, working for there almost for 23 years.
How do we define hypertension and when should we conclude that the person has hypertension?
देखिए, hypertension is defined according to various guidelines, but a patient is labeled to be definitely hypertensive once the blood pressure is above 140 millimeters of mercury, the systolic blood pressure, and the diastolic blood pressure is above 90 millimeters. But let me tell you one thing, which is very important, that a single reading of blood pressure which comes above this does not make a patient hypertensive. We need to have an average of at least 3 readings which are taken comfortably in a sitting posture, without legs crossed, in a cool environment, without any triggers, without any stress. And even when this reading comes high, the patient has to be given a chance. He has to be called again. The readings have to be taken again. And if these readings persist to be high, then only the patient is labeled to be.
Can high blood pressure be completely cured?
It depends on the type of blood pressure. It depends on the person. It depends on the age, and it depends also on the etiology. In case it's a secondary cause, that means some other underlying disease is causing hypertension, we cure that and that blood pressure will disappear. However, in patients who have mild to moderate hypertension, these patients are advised significant lifestyle modifications like good healthy diet, which is called the DASH diet, exercise, and patient is also advised proper sleep. Patient is given 3 to 6 months to practice these lifestyle modifications. These lead to significant reduction in blood pressure, and mild to early moderate hypertension can very well be taken care of just by lifestyle changes.
What precautions should a patient take along with the medications?
So my advice to all the hypertensive patients is never to stop taking salt, but to avoid these kind of extra salt that goes in our body, because this is a major cause of hypertension in us Indians. Second thing, must decrease your weight. Obesity in many cases is singularly responsible for a very high blood pressure, and once you are taking care of your obesity and lifestyle significantly, this will lead to decrease in blood pressure. So my notion, my mantra is exercise every day. 35 to 40 minutes of walking and exercise every day is going to increase your longevity by 35 to 40 minutes every day.
Public awareness initiative by Glenmark Pharmaceuticals.